Well, I've always said that step one is to pull mental health out of the shadows of stigma. Even if we build the best mental health care infrastructure in the nation, which we plan to, it won't be enough unless people feel empowered and supported when they make the brave decision to seek help. It will require us to undo years of misunderstanding and shame around the issue, but it's imperative if we're going to get everyone the care that they need. You know, I have loved ones who have struggled with addiction and mental health. I have wonderful children who are growing up in a time where youth anxiety and depression rates are skyrocketing. And as the governor of Illinois, I feel a responsibility to our millions of residents to help them become as happy and healthy as possible, including their mental health. For me, you know, I live my life in the public eye and don't get enough time with my family, but like to spend my time with my family whenever I can. But I also need time to myself. And, you know, I'm a problem solver by nature, so I enjoy the job that I have. And of course, when you're a parent, a husband, you know, there are a lot of challenges, problems that you're always trying to work through. But when I'm alone, I like to take on, you know, things like puzzles, challenges where, you know, you're problem solving in different ways. And it just settles my mind. It being alone, not having everybody coming at me from every direction. I just need calm moments of silence. And so that's how I take care of my mental health. In times of mental health challenges, the last thing that people should be worried about is navigating a confusing and expensive bureaucracy. And I'm happy to say that we've made progress in that regard. We've made historic investments in our behavioral health system, from facilities to workforce to affordability. And we've also set up structures and processes to carry out dramatic improvements, especially for families facing the daunting process of accessing care for their children. Care providers have come together across Illinois state agencies to build a better mental health care system and to provide more resources to our most vulnerable youth. In my fiscal year 2025 budget, I've proposed ending prior authorization requirements for inpatient mental health care. These administrative steps often provide arduous loops to jump through at just the time when someone is least able to manage them. If you or a loved one are in crisis, in the midst of it, you shouldn't be forced to navigate difficult insurance rules and bureaucracy.
Now it's your turn. Why is mental health important to you? Post on social media with the hashtag #Take5 for Mental Health.